Welcome to the place you will learn about the basics of any disease in a short way. Welcome to the Medicine Essentials. In this video I will talk to you about COVID-19 prevention. Let's start with the importance of prevention. At the moment, the therapeutic strategies to deal with the infection are only supportive, and prevention aimed at reducing transmission in the community is our best weapon. Aggressive isolation measures in China have led to a reduction of cases. Before we continue with this topic, we have to define who is a contact. A contact is a person that is involved in any of the following: providing direct care without proper personal protective equipment for COVID-19 patients, staying in the same close environment of a COVID-19 patient, including workplace, classroom, household gatherings, traveling together in close proximity, with a COVID-19 patient, in any kind of conveyance within a 14-day period after the onset of symptoms in the case under consideration. According to a study, a symptom-based screening process was ineffective in detecting SARS-CoV-2 infection in persons who later were found to have evidence of SARS-CoV-2 in a throat swab, and said that shedding of potentially infectious virus may occur in persons who have no fever and no signs or only minor signs of infection, who all needs isolation. 1. Any person diagnosed with SARS-CoV-2 infection by means of laboratory testing at a government-recommended testing laboratory. 2. Anyone who has symptoms of fever and respiratory illness, and has a history of close contact of a person who has either been diagnosed as COVID-19, or has a history of travel to a COVID-19 affected region within the last 14 days. 3. Any healthcare worker with symptoms of fever and respiratory illness, who has been involved directly in treating COVID-19 patients, or has close contact with persons involved in treating COVID-19 patients during the last 14 days. If needed, where to isolate. Asymptomatic cases with exposure to COVID-19 positive patients can be quarantined at their homes, but to be under strict surveillance by the government authorities. Suspected patient to be isolated in well-ventilated, preferably separate rooms. Symptomatic COVID-19 positive patients should be hospitalized in isolation room, and also should be monitored adequately by medical team. Sputum or bronchoalveolar samples, if needed, should be collected from isolation rooms or negative pressure ventilation. Can the virus stay on inanimate surfaces? COVID-19 virus can persist on inanimate surfaces like air, 3 hours. Cover, 4 hours. Paperboard, 24 hours. Plastic, 2 to 3 days. Stainless steel, 2 to 3 days. Hence, terminal disinfection is important even after the patient getting discharged. It can be efficiently inactivated by surface disinfection procedures with 62 to 71% ethanol, 0.5% hydrogen peroxide, or 0.1% sodium hypochlorite, within 1 minute. Personal protective equipment, PPE. PPE is used at risk health facilities and for aerosolized generating procedures. The PPE consists in gloves nitrile, powder-free, non-sterile. Mask, healthcare worker, medical mask, good breathability. face shield made of clear plastic and provides good visibility to both the wearer and the patient. It has to have an adjustable band to attach firmly around the head and fit snugly against the forehead, completely cover the sides and length of the face. Particulate respirator, grade N95 or higher. N95 or FFP2 respirator, or higher. Good breathability with design that does not collapse against the mouth. Scrubs, tops, tunic, woven, reusable or single-use, short-sleeved. Scrubs, pants, trouser, or pants, woven. Scrubs, reusable or single-use, short-sleeved, worn underneath the coveralls or gown. Apron, straight apron with bib fabric, 100% polyester with PVC coating, or 100% PVC, or 100% rubber, or other fluid-resistant coated material, waterproof, sewn strap for neck and back fastening. Gown, single-use, disposable, length mid-calf. Shoe cover. Goggles, protective good seal with the skin of the face, flexible to easily fit with all face contours, with even pressure, enclose eyes, and the surrounding areas. Respirators. N95 versus FFP3 and FFP2. The most commonly discussed respirator type is N95. This is an American standard respirator. Europe uses a filtering phase P score, FFP. Are N95 or N100 actually better than FFP2 or FFP3? Whilst the specifications for N95 or N100 are marginally higher than FFP, that doesn't mean the respirators are any better. Can surgical masks filter the coronavirus? Do they provide any protection? Surgical masks are primarily designed to protect vulnerable patients from medical professionals, stopping the wearer from spreading their germs when coughing/sneezing/speaking. So they're designed to protect people around us, not to protect the wearer. There isn't currently research available on the efficacy of surgical masks, or even respirators, for protecting wearers against the coronavirus. What can you do to reduce risk? Social distancing. Novel coronavirus are spread by people who have the virus coming into contact with people who are not infected. The more you come into contact with infected people, the more likely you are to catch the infection. Social distancing is infection control action that can be taken by public health officials to stop or slow down the spread of a highly contagious disease. Regular hand washing. It is recommended regular hand washing with soap and water for at least 20 seconds. Prioritize washing prior to eating and after being out. If soap and water are not available, use an alcohol-based hand sanitizer with at least 60% alcohol. Leave to air dry. Sanitize your phone. Given how often we use our phones, this seems like the next logical priority to be sanitized. Using antibacterial wipes or alcohol swabs, typically 70% alcohol, to clean your phone and other items is a good option. Sanitize other items you touch regularly, including computer keyboard and mouse, house and car keys, reusable water bottles, car steering wheel, clothing pockets, door handles. Avoid handshakes, hugs, and kisses. And the last thing you need to do is to keep your immune system healthy. How can you keep your immune system healthy? Examples of action you can take to maintain a healthy immune system are: sleep. Get adequate, high-quality sleep. For most people, adequate means 7 to 8 hours. A 2004 literature review concluded that sleep deprivation has a considerable impact on the immune response and should be considered a vital part of the immune system. Exercise. Exercise regularly, but don't overdo it. To quote a 2007 study on exercise and the immune system, moderate exercise seems to exert a protective effect, whereas repeated bouts of strenuous exercise can result in immune dysfunction. Foods. Studies have shown that fruits and vegetables provide nutrients, like beta-carotene, vitamin C, and vitamin E, that can boost immune function. Because many vegetables, fruits, and other plant-based foods are also rich in antioxidants, they help reduce oxidative stress.
This is the last of the 10 videos of COVID-19 series. Soon, I will make more videos related. Information is evolving fast, and we need to keep up to date.